My name is Dr Trevor Yellon and I'm a GP in King's Cross. I was involved with Breathing Country right from the inset, with at the beginning with giving some consultancy about electronic patient records. I am keen to be involved with other productions in the future, but at the moment that's the only one I've done so far. Actually, one of my patients works with the White Touring Company, and he asked me if I would like to be involved, and I was quite keen. So I went along to meet some of the people involved, and they talked me through the process. And I think it started with reading some scripts. I think it started reading some scripts and giving some feedback on the scripts and which one I liked the most and why, and which ones we didn't think was as good. And then meeting some of the kids involved, watching the production and getting involved in some of the feedback afterwards in the discussion. It was really interesting. Yeah. It was a very different thing for me to do. It's very different to my day-to-day job. So that was interesting and exciting in the first place. My experience was positive, 100% positive. It was really a brilliant experience. It was fantastic to be involved with something that challenged especially kids or young adults to think about an area of medicine or science that they would never normally consider, and actually to think more in depth about them and think about the ethical issues concerned with something that on the surface would appear to be boring or irrelevant, electronic patient records. But actually when you scratch the surface you realise there's a lot of ethical and moral issues. It's not a black and white situation. Kids like to think in black and white, so it was really useful watching them being challenged and realising that there's no right or wrong answer. It raised the issues in an excellent way. It raised all the issues that I could think of that to do with electronic patient records, from confidentiality issues on the negative side, on the problems with it, to on the positive side, issues with research and practicalities of managing patients with different illnesses. And it did that by raising them in a dramatic and interesting fictional way, but actually all the situations are real and are going to be real issues if EPR goes ahead. If you say electronic patient records to any member of the public, they're instantly going to go blank or glaze over. It's not, the word itself is boring and holds no interest for 99% of the population. If you dramatise it in the brilliant way that Ben did it, then you catch people's interest and you challenge people's perceptions. And I could never in a million years have realised, having been there at the start of this process, that you could go from electronic patient records to a piece of fiction that was really entertaining, and I really enjoyed watching and almost forgot that I was involved in it from a consultancy point of view, and just enjoyed it as a pure piece of fiction. And then having the debate afterwards made the people involved think about it from all different angles, rather than just watching it as pure entertainment, actually thinking about what the characters did. And all the characters, they weren't good or bad, they were flawed people who were trying to live life in the best way that they could, who were coming up with challenges that are facing all of us to do with our medical records and our patient and our confidentiality. So it wasn't just about the play; it was about the pre-performance activities, which were getting people to think about electronic patient records for the first time in their life and trying to make an opinion, and then challenging that opinion by showing them the play and then discussing everyone's feedback at the end. It was a very well-rounded and interesting way to think about it. Breaking down concepts to make them interesting and accessible to people who wouldn't normally think about them.